Coming up, we'll be on location at Metro Colon and Rectal Surgery in Rockville, Maryland, discussing the latest advances in colonoscopies, effective treatments for inflammatory bowel diseases, hemorrhoids, and more with one of this area's top doctors, Dr. Matthew Skancke. Welcome, Dr. Skancke, to the Top Doctors Interviews program.
Thank you, Nicholas. Our practice is thrilled that you were able to join us today.
There's been so many advances in colon and rectal surgery that are really helping people improve their health or deal with certain disorders and issues that they're having experiences with. But before we get into that, I wanted to touch on the fact that you're recognized as a top doctor throughout the DMV region. You've established a reputation, Dr. Skancke, for excellence in patient care and also in your specialization as well. So I wanted to begin by asking you about your vision for your practice.
Well, thank you for asking, Nicholas. My partner, Rami McCool, and I have been very interested in providing both a transparency and quality of care in an affordable and available practice model. Those were the hallmarks of the practice model that our mentor instilled in us as he built this practice, and we are just ecstatic to help continue build the practice and serve the patient population of Montgomery County.
The practice has a great history with Dr. Bradley Bennett, who's a renowned physician. He's been helping so many patients for years. He even operated on President Ronald Reagan as well. So I wanted to ask you, Dr. Skancke, what are some of the most common problems that you see with your patients here?
Well, by far the most common problem, whether it actually is the problem or not, is someone will come in and say, I have hemorrhoids. Now, the first thing that I have to do as a colon and rectal surgeon is figure out whether the stated complaint is actually the clinical complaint. So whenever someone comes in, we'll have a list of questions about why are you here, what are your symptoms, and then I usually will say, without using the word hemorrhoid, what brings you here today? And people will pause for a few seconds, collect themselves, and then begin to describe a set of symptoms. And with that, we're usually able to figure out where we're going. Now, of course, every individual who comes in will be offered a comprehensive exam to the limits of what we can do in the office. And a mixture of the history and the physical exam will usually lead us to a diagnostic plan. Now, our practice likes being transparent in terms of what we are offering and what we believe is going on, so we've added a lot of resources to our website, which is readily available both to patients and prospective patients, so that they can corroborate the information we're providing them with what we feel is up-to-date information in the field of colon and rectal surgery.
Hemorrhoids are something that we're all very familiar with. We've heard the term as well. And it's great that we can come here to take care of that issue. What other problems do you address, Dr. Skancke?
Well, we address issues essentially from the middle of the small bowel and the beginning of the small bowel up until the anal canal. So physiologically, anything from the midgut to the hindgut is within the purview of a colon and rectal surgeon. So tumors of the small bowel, inflammatory bowel disease, congenital abnormalities of the small bowel, and then you can continue that to the colon, to the rectum, and the anus. So diagnostic terms that some individuals would come to see us for would be Crohn's disease, ulcerative colitis, cancer of the small intestine, the large intestine, or the rectum, diverticulitis, bleeding from diverticular disease or bleeding from other disease patterns, ischemic colitis, or the rectal cancer, anal cancer, or other anal pathologies related to a number of different disease processes, whether it is malignant or benign.
I know you touched on quite a few different health concerns. What are some of the most effective treatment options that are available?
Well, it really depends on the disease process. We always advocate for individuals having the appropriate screening test based on their age and risk factors. So while we do have a lot of carryover with our colleagues in the GI department, we also like to make sure all individuals are getting their appropriate colonoscopy at an age-appropriate time. Now, you and I could probably spend 30 to 40 minutes and still only scratch the surface on age-related screening of the colon and rectum, either for individuals who are at high risk features or just regular risk features. Most individuals will have a 4% lifetime risk of having a colorectal cancer, so it's not something that's insignificant. And All it takes is a simple conversation with your neighborhood proctologist or your neighborhood gastroenterologist to bring yourself up to a level of literacy so that you can make an informed decision on your screening.
And how effective are these treatment options? What kind of results have your patients been seeing?
Our practice has been very fortunate in that we've had very good results with our patient care. We'd like to attribute that both to the transparency in terms of preoperative, intraoperative, and postoperative expectations, and also the fact that both my partner, Dr. McCool, and I had a very good mentor who helped train us for the better part of 2 decades between the two of us in the prime years of his career, really setting us up for success and continued quality care for Montgomery County residents.
And Dr. Skancke, are there follow-up visits required, or are the results permanent?
So it depends on the disease process that we're treating. In certain situations, we can provide a definitive treatment. However, in other situations, continued care is needed. Now, this is disease and diagnosis dependent, but we may initially see an individual for a certain diagnosis, treat it, obtain permanent results, but then in the workup, identify another thing that could either be inconvenient, concerning, or life-threatening. And that really provides the proctologist with the ability to not only provide targeted care, but also provide preventative care.
And if a patient is experiencing some symptoms for any of these types of disorders or issues, what's the process they can expect when they first call your practice?
Our practice is unique in that when you call our office, you'll be answered by a human being. And I consider that to be a rarity these days. Furthermore, if you are calling our practice and you are an experienced patient, if you want to speak to Dr. McCool or I, you will speak to Dr. McCool or I. It may take us a minute to get back to you because we may be operating, we may be taking care of another patient, or we may be at another facility. But it will be your surgeon who answers the phone call. And if for some situation where Dr. McCool or I are not available, the other one, who is also a board-certified colon and rectal surgeon and aware of your treatment plan, will be contacting you to provide the same quality of care that you would expect from your index surgeon.
Well, that's what I really love about your practice. You're really patient-centric, and that's how Dr. Bennett had established his practice, really putting patients first, taking the time with each patient. Like you mentioned, there are many practices you call in, it's all automated. You don't even get to speak to a human for a while, and that's frustrating, especially when you're dealing with health issues, right?
Yes.
And also, when patients come in, you take the time with each patient to really understand what's going on. They're not just a number where, you come in for 1 minute and you're gone.
Yeah.
You really sit down to learn that patient's health issue, because everyone's different and there's no cookie cutter approach.
And it goes back to like what we were talking about initially. Everyone may come in with what they believe are hemorrhoids, but it may be a number of different things. Some scary, some not scary, some in the middle. And that's why the comprehensive care that we provide at Metro Colon and Rectal is at the top of the class in Montgomery County.
Well, Dr. Skancke, that was very informative. I want to thank you so much for joining us and being a guest today on the Top Doctors Interviews.
Thank you very much. Our practice is honored to be considered a top doctor in Montgomery County.